Welcome back. February is Cancer Prevention Month. The disease, the second leading cause of death here in the U.S., and health experts are encouraging Michiganders to take a closer look at their personal cancer risk and steps that you can take right now to reduce it. We're joined by Dr. Bitner with True Women's Health to talk about this. We know lifestyle changes can make a big difference in preventing cancer. Also important to get the screenings that are available for the different types of cancer that they can screen for.
Exactly. I think first it's talking about those lifestyle steps we can take in terms of prevention, and just thinking about, like, what is cancer? Cancer is started by a cell that goes rogue. It's a cell that doesn't follow the rules. And sometimes if a cell is constantly irritated, let's say with cigarette smoke, then it gets irritated, and then all the body checks that try to fix it just over time are overpowered, right? So things like preventing cigarette smoke, but also getting sleep, keeping your immune system strong in terms of stress, like, of course, dealing with all the stress that we deal with. So it's looking at those lifestyle things and why they work.
Right. And, you know, so many of us have been touched by cancer or a loved one affected by cancer. So this hits home for a lot of people. As I mentioned, there are some screenings available, but there are so many types of cancer that you can't screen for.
Exactly. We can group cancers into like 100 types of cancer. So 100 types of cancer. We currently screen well for 4, right? So we screen for cervical cancer, colon cancer, breast cancer, and in some people we can screen for lung cancer, like people who have smoked for over half a pack a year for 10 years.
Yeah.
So having said that, what do we do with the rest of the cancers, right? Like ovarian, pancreas, all those cancers that are really, Katharine Hepburn died of appendix cancer, right? Like these things really happen. And so how can we screen for these? So thank goodness we do have a new option.
Yeah. So tell us about that. We've done a story on this, the Gallery test, but for those that are not familiar, what is that and what is it? How does it work?
Gallery test doesn't diagnose cancer, but it looks for those DNA signals in the blood that there's a cancer there. And so Gallery picks up these DNA signals and then uses AI to figure out where in the body is this coming from. And so it's looking for, is it a blood cancer, which can be really confusing and hard to diagnose? Is it a cancer from the GI tract? Is it a cancer from the head and neck? And so with this early detection, if a positive test happens, then we go looking. And we often can then find a cancer very early.
Wow. And I know it's still relatively new. A lot of insurance companies are not covering this, but it still might be worth the cost if you have a concern to be proactive.
Exactly.
So tell us
Which takes us to Jane, right? So Jane is, I think she was 48, but her husband had just passed of a heart attack, sadly, and she was left with 3 small children, and she was like, I cannot get cancer. Now, she didn't have a strong family history of cancer, but it was still on her mind that she wanted to make sure she was doing all the things. And so she chose to have the Gallery test, even though it's not covered by most insurances. And thankfully it was negative, but what that did for her is it gave her peace of mind. You know, I've done my pap smear, my mammogram, I've done all the things, and now I can rest assured that there's no signal for a cancer that I might be missing.
Yeah, having that relief is priceless. And the Gallery test, quick question for you.
Sure.
Recommended, you know, once a year, every 5 years? How does that work?
So first of all, we know that women in midlife have a really sharp increase in risk of cancer, men as well, but 50 tends to be that number where it's like a hockey stick. So certainly at 50 and older, and likely every year. It's one of those things that it's coming, you know, like Google offers it to all employees, like it's coming, and again, several insurance companies pay for it, and so again, maybe every year, depending on the budget, right?
Okay, so talk to your doctor about that. What is your takeaway tip?
For you.
Yeah.
Yes, so understand your risk for cancer, but see if a screening test like Gallery is right for you, and take care of yourself. Like, cancer does not have to happen.
Right, and as you say, ask yourself, do you want cancer? You have to really ask yourself.
Seems rhetorical, but yet,
I know.
Are you committed to the answer?
Right, all right. Lifestyle changes, and obviously talk to your doctor and get some more
See
information.
if it's right for you.
Thank you, Dr. Bitner. We'll be right back after this.